Another commonly asked question whenever I do a breast augmentation consultation is what type of shapes of implants are available? Well, traditionally we've had the round implants, the round shape, as you can see here. I'm holding one in my hand. But over the last 10 years we've had a new type of implant that's come in, which is the shaped implant or teardrop shaped implant. Now this is a teardrop shaped implant, as you can see here. Now the shape of an implant always refers to what they look like when they're just sitting down flat. However, you have to understand implants don't normally sit flat. They usually sit upright, just like the body. Now the teardrop shaped implant, as you can see here in the profile, and I'll just sort of twist it a little bit around for you, simulates a teardrop shape. Okay. Now, the reason it does so is because it's thicker in one end and thinner at the other end, top end. Now, the reason they're able to do this is because this is a thicker gel. It's preformed to this shape. Now, that's what the teardrop shape implant. Now, the round one, as you can see, again, refers to what it looks like when it's flat. However, having said that, when you actually put it upright, as it is normally when you're standing up, it actually falls into a bit of a teardrop shape effect anyways. And in fact, when you put them side by side together, you can see here, there's not a whole lot of difference in them. The only difference perhaps is the fact that this round one, by virtue of the fact that it's slightly fuller, gives you a bit more fullness in the upper half. So in reality, what it'll do is give a bit more fullness in the upper half of a breast. Now that's not a bad thing necessarily, because you have to understand women who come to me asking for a breast enlargement, that's one of the first things they say to me, I'm very empty up here. And so in these circumstances, the round one will actually provide that fullness quite a lot better than perhaps the teardrop shape. Now, one of the other implications with a teardrop shape implant, in fact all implants, is the fact that implants can move around within the pocket that we create behind the breast. Now, normally, as I explained, the implant has to sit in this position. Okay? However, in certain situations, the implant can rotate and move. Now, if I rotate this implant like that, you can see here, we get an upside down shape. Now, that's not a good thing. And so that is one of the potential worries whenever we put a teardrop shape implant into the breast. We try to minimize this by making a very specific pocket, a tight pocket to accommodate this implant specifically. However, nonetheless, under certain situations, perhaps manual handling in the breast, it can actually move around. Unfortunately, they're not screwed in or nailed in, and so they do have this tendency to move around. Now, the round one, on the other hand, can do the same thing as well. However, when this moves around, as you can see here, it actually folds into a teardrop shape again, by virtue of the fact that the gel in this implant is a little bit more fluid, a bit more elastic than the more rigid implant, more rigid gel in the teardrop shape implant. So that's something that's, that people need to know before they make any decisions. The vast majority of patients, in my practice at least, choose the round implant because of the fact that they never have to worry about any rotation, and the fact that there's not really a whole lot of difference in terms of actual shape between the teardrop and the round one anyway.